Hi viewers, welcome back. In today's video, we are going to discuss about the minor disorders in the postnatal period. So, antenatal periods we have already discussed the minor disorders, but now we are going to discuss the minor disorders in the postnatal period. Okay, so postnatal period we have lots and lots of complication, but there are some minor problems existing. So, these problems, it is not a great trouble for the mother, but she has to understand what is happening and then she has to react. Only that much has to be done. Okay, so she will recover from these minor disorders very easily. So, in this, first we have after pain. So, after pain is nothing but after delivery pain. Okay, so that also you can say. So, what is happening here? It is the baby, till now it was there inside the uterus. Okay, so now the baby is expelled, and now what is the activity of the uterus? It has to see whether any remnants are there inside the uterus. So if something is there inside the uterus, it is the responsibility of the uterus to push these products outside. So now it is waiting for that work to be done, and now everything has come down: the baby, placenta, the fluid, the waste, okay, everything has come down. But now also, that is for the next 2 to 5 days, what happens is the uterus keeps on trying to contract and contract, so that it is trying to push whatever is there. Maybe it is the remaining bits of the placenta or the membranes it is trying to push. So that pain, we say it is after pain. Okay, so just imagine the mother is having this much amount of pain. So what you have to tell the mother is nothing to worry. Okay, so this is what happening. Okay, the uterus is trying to push what is there inside the uterus. So nothing is needed. So whenever you feel that heavy pain is present, you can just do an abdominal massage. Okay, so mild abdominal massage will be very effective. In case if it is not okay, then she can also have a small towel or something to support the uterus, that is like to support the pelvic region. So once this pelvic region is supported with a small pillow, she will be little more comfortable. Okay, so that also she can follow. Sometimes what happens is like the bladder will be full. So when there is a full bladder also, there will be a pain, that is like there will be a pain in the uterus. Okay, so there, like when there is an enlarged bladder and that is compressing the uterus, so that may also cause pain. So what you have to tell this mother is like she has to frequently urinate. So once she is frequently urinating, her bladder will be empty and the uterus, like already it is empty. So with that, contractions may not be initiated. So okay, you tell the mother like frequently she has to empty her bladder. So in case again the pain is persisting, and in case if the mother is unable to tolerate the pain, she can go in for mild painkillers and antispasmodics. That will be relief giving and that will be enough sufficient. Okay, so she will become alright. That is only for 3 to 5 days. Then by the time like all the remnants would have come out and nothing will be there in the uterus to have any more contractions. Okay, so that is with your after pain. And then pain on the perineal region. Okay, so pain on the perineal region can be due to many causes. So one is the episiotomy suturing. So you have sutured that area and you know like it is the area is going to be a wound, and this wound will have inflammation and pain. Okay, so that you have to understand. This healing of this perineal wound will take little more time. So you have to encourage the mother, tell that, make her understand this healing process will take little time, that is like 1 week, 10 days it will take, but she has to keep on sitting and moving with her work done, so that active level, that active walking and sitting, that will promote the blood flow to the perineal region, that will cause wound healing easily. You can also encourage the mother to go in for a sitz bath. So sitz bath is like you will have a basin, and in that basin you will have betadine solution poured in that solution, or otherwise you can even use potassium permanganate. So however your doctor wishes, so anything, just a warm water, so anything however your doctor says that you have to follow. Okay, so use that solution, make the mother sit in that solution. Okay, so that warm like saline or the warm water will give a very soothing effect, increases the blood flow to that area, and the wound will heal very fast. Okay, so this is very effective method. And your perineum you have to read. Okay, so you have to read for the Rida scale. So what is Rida scale? Already we have dealt. Okay, redness, ecchymosis, erythema, discharge, and your approximity. So accordingly you have to see your wound, Rida you have to assess. And then comes the constipation. Constipation, again it is a very common problem after delivery. So what is happening is, mother will have delivery. So this is like a cycle. Okay, so mother's delivery is over, she is having an episiotomy wound, she is having pain. So what will happen in the sense, when she is feeling like to pass bowel, like pass motion, so what will happen, she will have the thought of pain. So once the thought of pain comes, she doesn't want to pass stools. So once she is not passing stools, then it will become hard stools. So again it will become a problem during evacuation. So this is like a cycle where the pain of this episiotomy and the labor pain has initiated. So this becomes a cycle, and because of that the woman goes in for constipation, and because of that this is continuing and continuing, and where she is not able to get cured very easily, because this constipation is becoming more and more because of the pain level. Okay, so you have to make the understand, give more fluid to the mother, give lot of fiber rich diet, and like promote the activity of the mother. Tell the mother to keep walking, tell her to be little more active, so that her bowel movements are taking place little actively. So once this active phase begins and her dietary pattern is stimulated, then what will happen, she will become normal and her constipation also will be relieved. So that is with the constipation. And then we have excess perspiration. So excess perspiration is nothing but sweating. Sweating is going to be more in the postnatal period. Why? Sweating is more in the sense, see, already lot of muscles and the fat gained during pregnancy. Now this postnatal period only she is going to lose this. Okay, so usually in this postnatal period the mother will lose lot of weight. So all her sweat glands will open, and the pores will tell the body to lose weight. The excess weight that was gained during pregnancy is going to be lost. So I encourage the mother to go in for bathing 2 to 3 times per day, and like she has to keep her breast very clean so that the baby has to feed. So when there is an excessive perspiration, what will happen, the mother will smell bad. So when she is smelling bad, the baby will not take feeds. The breast milk smell alone the baby can feel. The baby doesn't like any other smell. Okay, so if the baby is smelling the sweat, the baby will not take milk from the mother. So always tell the mother she has to be very neat and clean when she is feeding the baby. So tell the mother to take bath at least twice or thrice a day, so that she is very like without any smell, she is okay, and the baby takes breastfeeding adequately. Okay, so perspiration you have to see. So for that perspiration, you encourage the mother to wear light cotton clothing. You can encourage, tell the mother to have lot of fluids to balance the fluid loss. All these things can be encouraged. And then anemia. See, always mothers, they usually have a tendency. Okay, so once the baby is delivered, the baby is out. So now I need not take care of myself. Okay, mothers are selfless creatures. Okay, so it naturally it is like that. So your mother was like that, and one day when you become mother also, you will be doing the same. Okay, so no problem, but whatever it is, they have to take care of their health. So during delivery, what has happened? There is lot of blood loss for the mother. So how to compensate this blood loss? She has to take iron and calcium supplementation. Iron supplementation will improve the HB level of the mother. Once this iron supplementation is not taken by the mother, what will happen? She will land up with anemia. Already whatever there was inside the mother, that is already taken up by the fetus. So no like storage is there inside the mother. So now whatever taken out and whatever blood that was lost during delivery, that has to be compensated only with the iron supplement that is taken in the postnatal period. If the mother is saying anyway baby is out and what to take care of myself, then what will happen? The mother definitely will go in for anemia. So tell the mother, so now the whatever that was lost, now you are going to get compensated for that. Okay, so try to take iron rich foods and like encourage the mother to take ragi, jaggery, green leafy vegetables, all these things which can improve the HB level of the mother. Okay, so anemia can be prevented. And then we have finally hypertension. So hypertension is a very common problem, like maybe she would have hypertension during pregnancy, and after delivery also you must have an eye on the BP level. You have to see to that the blood pressure level of the mother is maintained, it is in the normal phase. So until then you have to be your drugs, your magnesium sulfate or like whatever drugs you are following for that, everything has to be continued so that her BP level becomes normal. So till that time you have to continue with the like blood pressure level maintenance you have to follow. Okay, so with this we finish our minor disorders during the postnatal period, where we had spoken about after pain or the after delivery pain, then the pain on the perineum, constipation, excessive perspiration, anemia and hypertension. Hope you understood the class. In case of any doubts, kindly clarify your doubts in the comment box, and if you want any more videos also you can tell it in the comment box. Hope you understood the class. Let's meet in the next class. Till then, bye.